Okay, I'm about ready to go to sleep. It's been a long day. I am going to answer a question that came from our Facebook page. You could find Medical Coding Geek on Facebook. This question comes from LaShawn. And the question is, well, it's the two-part question. I'm going to answer the first one today. The question is, can you help me understand the best way in finding the main term? So what she means in the main term is when you are coding a diagnosis and you have to first find what the main term is in order for you to go into the alphabetic index, find the specific term, it relates to the specific code, then you go to the tabular, and then you find the actual code based upon what is documented. The way I understand the main term is if you go back to your understanding of English, the English class. So when I think of main term, I'm thinking like a noun, right? And everything that revolves around that noun, for example, like an adjective, that's something that would describe the main term. Okay, so the best way of understanding how to identify the main term is it's a couple things, right? You have to go back to what you learned in medical terminology. Okay, what you learn in medical terminology will help you determine what that root word is. That'll also help you understand what the main term is. When I used to teach coding, ICD-9, gosh, it was ICD-9 and CPT-4. The best way of coding is to start off with a phrase, like 1 to 2 words, right? And then you have to code from there. And you have to identify out of those 2 words what is the main term. I try to identify what is the noun out of that entire condition. And medical terminology helps because it helps you understand and really look and hone in what that diagnosis is. Okay, and once you know what that diagnosis is, you'll find it in the alphabetic index. Once you work into phrases, the next goal though in identifying the main term is from phrases like 1 to 2 to 3 words to going into a sentence, right? How can you find the main term in a sentence? Once you're good at that, then how can you find a main term in a paragraph? All right. Then you progress to finding a main term in a page, then pages, then a section of a medical record, then the entire medical record. You see where the progression is trying to find a main term. Now you're just only finding one main term, but now multiple main terms because you're essentially going to code more than one diagnosis, more than one procedure. Okay. To answer your question, it really goes back to 2 things. English. For me, my teacher really worked on helping me identify what is a noun, sentence structure, what is an adjective, and finding all of that in a sentence. And then also your medical terminology. So those classes are very important because they are the building blocks for you to go into understanding how to assign medical codes. It is Wednesday. I'm going to stay on track and answer LaShawn's second question. And our next question is, how can you better understand the guidelines? So guidelines are basically, to me, policies and procedures that you have to understand to know your job. Now, to understand
coding guidelines. There are many coding guidelines. You won't understand the guidelines unless you're working with them. And if you work with them, you'll only understand them if you work with them frequently. So if you're a coder in a hospital, if you're a coder in an office, if you're a coder for an insurance payer, you will, I guess, have that guideline ingrained in your mind and have that ready to access when you keep on seeing it on a daily basis, on a regular basis. It's to the point that you memorize the guideline, and if you already looked at the medical record and you already anticipate using that guideline, then that's when you know that guideline. It's something that doesn't happen overnight. It's, again, you have to keep on looking at it. Repetition is very much key in anything. Medical terminology, medical coding guidelines, understanding your medical codes. Repetition is key. The more times that you see it, okay, it's not about understanding it, it's about seeing it, because when you have some form of visual memory in the back of your mind, you'll be able to recall it. To better understand your guidelines, you've got to keep eyes on it all the time. Repetition is key, and understanding how to apply it, because little by little, the many repetitions you'll do, it'll slowly improve your understanding of that specific guideline. And there are many guidelines, so just be prepared. It's like having a utility belt ready to go. Whatever situation comes your way, you're ready to access that specific coding guideline. Alright everybody, today is Saturday. I haven't been vlogging for a while, but that's okay. I wanted to talk about a case that I had this week that I, again, when I write it down, I should have talked about it. But so this is a case, okay, I remember what it is now. This is a case where a patient presented with a low hemoglobin, low hematocrit, probably from the office. When they drew the labs, they saw it being low. They sent the patient over to the hospital for evaluation of the low hemoglobin and hematocrit. Without going too much into the story, they did find the patient to have an arteriovenous malformation, which is in the GI system. And basically, it is a abnormality in the venous system within the GI system that can lead to possible chronic GI bleeding. And I've seen it in cases where it's acute. I've seen cases where a patient comes in every time with low hemoglobin, low hematocrit because of this arteriovenous malformation. Anyways, in the past medical history, it's stated that the patient had respiratory failure. But in the discharge summary, it was documented that the patient had respiratory failure. The problem was that respiratory failure was listed on the problem list. Okay. And when I looked through the chart, looking through physical examination, looking through vitals, seeing if the patient is on oxygen, there was nothing. No tachypnea or work or breathing, any kind of distress. The patient's saturations were normal. The patient was on room air the whole entire hospitalization. Again, the problem is the physician documented in the problem list respiratory failure, did not update the problem list. And as such, the coder, with that mindset, whatever is documented, we code it, decided to code it without validating, without a quick validation. I mean, it really should have been quick. So as a result of that, I took out the respiratory failure. Now, the problem lies again on the problem list. Why are we having this issue? Well, it really stems from the ease of, it is a product of the electronic health record. And
The problem is, with the problem list, is copy and paste. And so when things are copy and pasted without updating, you could see where that coder decided to make the decision to code the condition because it is listed on the problem list. As a CDI, I would look at that, okay, and look through the physical examination, all the clinical information, doesn't take much, and then possibly ask a query. Hey, your problem list shows the patient having respiratory failure, but all the clinical issues, all the clinical indicators show no respiratory failure. Can you comment as such? And that's the problem. That's the problem with the problem list, is that it's not updated. It should have been updated. It should have been dated. I've seen cases where problem lists are dated. I think that's a better way of doing things, or even saying resolved. I've seen cases where problem lists are resolved, ongoing, or active. That's something that can be done as well if you're talking to your IT team to create templates for your EHR. But bottom line, those problem lists have to be updated. And also, as the medical coder and the CDI, you need to scrutinize the problem list and make sure that it is, everything on that list is legitimized and clinically validated.
When you are deep into coding a medical record and someone disturbs you, there's a code for that.
What's poppin'? Don't mind me just watching.
So while I was working, 3M decided to not work anymore. So now I have some free time to talk about this last topic for the vlog. This topic came from AHIMA, not the official one, but an AHIMA Facebook group. And let me actually read the question here. The question is HIM a flooded field? A flooded career field? Or is it growing? She is concerned about job prospects if she chooses this degree. Now, let me flip back over. All the lawnmowers going on in the in the background. I'm gonna take a picture of this, but the question is the HIM industry getting saturated? Is it a flooded field, or is it growing? So I like to do somewhat of a kind of infographic here. All right, so I'm going to take a picture and let's just return it back to me. Perfect. While the lawnmower is going on. Anyways, so is it flooded or is it growing? I think it is flooded in the sense of traditional roles, because when you go to an HIM program, or if you're led into an HIM program, may it be through an educator, may it be through some form of advertising, or maybe, some type of salary or growth study in an industry, you're told, okay, well, in this field in HIM, you're going to go be an HIM director, or you're going to be a medical records technician, or you could be a medical coder. Those are the, I guess, areas in HIM that, to me, I feel is very traditional. So when you get into school, that's what you're pretty much taught, is how to get into a traditional role, right? Because when you think about educational programs, because I'm talking from experience, because I used to be an adjunct instructor for HIT programs for, I think, for three schools, 2 schools in person, 1 school online. And you're really given a syllabus, you're given a program schedule. You have to finish the program, or you have to finish the course within a certain period of weeks. And there's so much information that you can kind of push into that certain amount of weeks. So even with that limitation, you're only really teaching them how to be a traditional role type of person. Okay? So when students coming in, that's what they feel that they can only do, and that's unfortunate. If you want to grow, well, this is my response. Let me read my response here. So HIM is a field where you need to get creative and not limit yourself to being a medical coder or an HIM director. If you can grow outside the box of HIM, you will flourish. Now, I'm going to refer back to that little screen, the picture that I have on my board here. It's flooded in the sense of traditional roles, but it's growing in the sense of non-traditional roles. So what are non-traditional roles? Anything outside of HIM is non-traditional. Because I think if you can leverage, I think that's the key. If you can leverage, that's what I meant when I said get creative. If you can leverage what you have learned. Because I think students who get into school, they think, okay, RHIA is the way to go. And they neglect everything that they just learned. They neglect all the classes that they have taken. What you need to realize is that the classes that you have taken can be leveraged not just in HIM, but also in other areas in healthcare. So if you learn how to leverage it and promote it well with people who you are trying to get in work with, they'll see the benefit of what you have obtained in your education. That can be related into non-traditional roles. Now, again, outside of healthcare, outside of HIM, well, not so much outside of healthcare, but outside of HIM, you can get into compliance, you can get into quality, you can get into health information technology, IT, if you have the right connections. I think that's what it is. Because the HIM degree, the HIM program is very, it covers a wide variety of topics. And you could really take one course and kind of run with it after you get with your degree. That's what I tried to do when I got my degree. I tried to get into I tried to get into information technology. But that didn't work out right because I was given another opportunity that I did not want. As mentioned in other podcasts and other live streams, I was offered a coding position, a CTI position that I really didn't want, but that's the path that was given to me, and that's where I went. Now, another thing that I do want to add on here, I'm going to highlight this area, is you have to look at the landscape of academia and certification. There are a lot of schools out there and a lot of educators providing CEUs, boot camps, and whatever. And a result of that, they are producing new graduates. They are producing young professionals or new professionals into the field. So can you get a sense that it is getting flooded? Yeah, most certainly it is. Also, you want to think about is the exam requirements. Now, I don't know about AAPC, but there have been reports, and I should do another video on this, and I've done podcasts on this, is where AHIMA is lowering their requirements, their requirements to take the exam. There's no longer a need for work experience. Those are things that are needed to be changed. I know CCS also changed that you don't. Before, I believe you needed to go to a school, but now you don't. I have to verify that, so don't take my word for that. But the exam requirements are changing. I think the best word to say is they are easing requirements to allow more people to take the exam, so that way more people can get certified. I see it in a way that, yes, we need to have more certified professionals, but then we're flooding the field with more certified but not experienced professionals. I think if you need to get a certification, you should have some form of experience. But then again, you're probably going to say, well, how can I get experience without experience? And that has to deal with networking. Okay. And that goes back to a few vlog posts ago about the person, interviewing in the second semester. And that's not working. If you start early, that's how you fix that. So number of schools are going up, number of educators are going up, there are new graduates, there are new certified professionals. Exam requirements are easing. So I can see why it's flooded. So what do you need to do in this, I guess, so-called flooded field? You need to stand yourself apart from the rest. And what makes you better than the person who is also certified? Again, I just did a podcast with Juan Sancho, and he teaches many students in his program. I believe it was AAPC International. And he made a point. He made a point that you can have a very good student who has A's, who passes the certification exam with high honors, whatever it may be, but they can't get a job. Why? Because they don't have the interpersonal skills, the networking skills to get that opportunity to make it happen. You know, your knowledge and your skills can only take you so far, right? It can only take you to a certain limit. And that's where this limit here is where everybody is at. This is where the flooding is. So everybody's flooded. They're like, oh no, I can't get a job. All right. So if you're here flooded, complaining about it, so what are you going to do to get your head above the water? What are you going to do to survive in this flooded field? That's something that you need to think about. But for me, I've done many things. I've created a podcast. I've started a YouTube channel, just to get the word out there, just to get me recognition, to get my face out there, to get my name out there, to increase my digital footprint. So that's something you guys need to think about. So this wraps up this vlog. This is a very long entry. So thank you for watching this video. Thank you to all the new subscribers. And if you enjoyed this video, please like this video. Please subscribe to this video. We have over 400 subscribers. Yes, so we're closing in on that 1,000. Thank you guys very much, and I'll see you guys in the next vlog.
MedicalCodingGeek.com